Question: during disaster planning, a consulting road be asked to participate in which of the following activities? Option A. Development of a list of all food vendors with delivery schedules. Option B. Assessing food inventory for adequacy. Option C. Preparing a checklist of food safety procedures. Option D. All of the above. The correct answer is option D. Question: which of the following is true for reactive hypoglycemia? Option A. It is defined as a plasma glucose level less than 70 mg/dl. Option B. It is treated with a diet high in complex carbohydrates. Option C. It is diagnosed by measuring blood glucose levels 1 hour after eating. Option D. Peak insulin activity occurs 90 to 180 minutes after food is eaten. The correct answer is option D. Question: in behavior modification, the term extinction is defined as option A. Punishing undesirable behaviors with negative feedback. Option B. Encouraging repetition of desirable behaviors. Option C. Reducing undesirable behaviors by withholding positive reinforcement. Option D. Identifying behaviors that were common in childhood. The correct answer is option C. Question: features of the Nutrition Screening Initiative (NSI) include: Option A. Use of a 20-question checklist to assess nutritional and health status of elders. Option B. Identification of factors that place elders at increased nutritional risk. Option C. A focus on elders between the ages of 65 and 75 years. Option D. Identification of elders who have a BMI of less than 20. The correct answer is option B.